everyone is ready to consult with our resident gynecologist, Dr. Maluleke, who joins me in studio now for an hour of female health talk. Let's take a call.
Doctor, I have a problem on my right. I don't know if it's fallopian tube or ovary. I have something like a growth. It's painful inside, and then outside it's like a bump. It's like a small egg.
I do not believe that what you are feeling is on the tube or the ovary, because those are structures that are very far from the abdominal wall, and it's not very easy for you to feel that. So it could even be just an abdominal wall swelling and not necessarily be on the tube and or the ovary. It is still important for you to go and consult your general practitioner. They will examine and they'll do an ultrasound, because an ultrasound would be the quickest way of confirming the location and the nature of the growth you're talking about.
Conversations, Mondays to Thursdays, 6:30 p.m. to 8:30 p.m. with Rebecca Pala.
The time is 23 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. It is indeed time to consult our resident gynecologist, Dr. Maluleke, joins me now in studio. Doctor, good evening. Welcome.
Evening, Rebecca, and good evening to our listeners.
Are you well tonight?
I'm well, and how are you?
Well, thank you. Let's quickly remind everyone of how to get in touch with us if you would like to ask the doctor a question. The WhatsApp line for text messages is 079-295-1212. 079-295-1212. The voice note line is 060-771-5107, 060-771-5107. And if you would like to give us a call, the number to dial is 015-151-1058, 015-151-1058. All right, Doctor, we'll start with some of the questions that we could not deal with last week due to time constraints. I'll begin with this one. Good evening, Doctor. I'm 8 weeks pregnant and I'm having constant urination that is sometimes even short. Can that be UTI? Yeah. And what advice do you have in regards to that?
Right. We had said that UTI would be accompanied by a lot of discomfort. If all what she's having is frequency, then it probably suggests that this is pressure on the bladder from the growing uterus. And that is something that you can't do anything about. Because as the baby is growing, this uterus, which is still in the pelvis, is now expanding and it is putting pressure on the bladder. However, as the uterus becomes an abdominal organ, this will then be relieved. Later on, when the baby's head descends into the pelvis, she'll also experience the same thing. But if the frequency of passing urine is accompanied by burning and or pain, then yes, that could be urinary tract infection, and that needs treatment. But the former problem, as she has explained, does not necessarily need medication.
And this begs the question, just how much knowledge is out there about bodily changes that come about because one is pregnant, like constant urination, as they're explaining?
Yes. You know, with the advent of Google, some of this information is out there. There are what we call symptoms of early pregnancy or minor ailments that accompany early pregnancy. And if people were to go and look out for these things, they will find useful information there. Although in general, one discourages the use of Google to try and solve your medical problems. But one of the things you'd experience is frequent urination, being bloated, constipation, for example, nausea and vomiting. These are some of the things you'll experience as a result of you being pregnant.
All right, Doctor, let's listen into a voice note that has already come in.
Good evening. I actually want to ask, though it is a sensitive matter to me, since I've been sexually active last year around June, July, things have been very difficult and challenging as well because I feel as in my vagina entrance is blocked. and the pain is intensive, like I cannot handle it. So earlier this year, around January, I went to do a pap smear because I thought I had a problem. But then when the results came, everything was normal. They said, but I'm still experiencing the same problem, and now things are getting worse. So I want to know what could be the problem, because the pain that I'm feeling is opposite to what everyone around me is describing this sex thing.
Doctor?
Right. She's experiencing pain with intercourse, and in her expressive way is that she feels like the vagina is blocked. She could be experiencing involuntary contraction of the vaginal muscles, what is known as vaginismus. Vaginismus, in fact, in some severe cases, would make it impossible for a couple to consummate their relationship because there is spasm there, and if they do have intercourse, it becomes very painful. It is believed to be largely psychological. Some of the issues that we talked about last year, part of the upbringing and the taboos that are there with regard to intercourse. And some people, because intercourse is dirty, maybe also as a result of being abused in early childhood, these things will then impact on the individual's experience of the sexual act. Well, she's talking about having gone to do a pap smear.
Yeah.
I'm not sure if prior to doing the pap smear, she presented her primary problem. And what was done about it, because like I'm saying, being a largely psychological problem, she may need clinical psychologists to try and solve her problem. So I would urge her to go back and explain this as a problem and let it be attended to, because unless that is done, she's likely to remain the way she is currently.
And just because you had already sort of recalled that we've been speaking about it even last year, I remember even last week we spoke about it.
Yeah.
And it begs the question then, doctor, to say, if such is the case that what is said to people on a continuous basis then affects how they experience sexual intercourse, which is expected to be pleasurable, then how common is it in our society?
Fairly common. Very, very common. Like we said last week, these issues are not talked about, and people are actually, if we had listened to the voice message when she started, she says this is sensitive, right? It's a sensitive matter for her, and this is what many people go through. They don't want to talk about these things. They don't want to go out and seek help, because it could be sensitive, it could be embarrassing. And sometimes they feel less than women. They are not, like she said at the end of a voicemail or a voice message, that the pain she's experiencing is opposite, or what she's experiencing is opposite to what everybody is experiencing in this sex thing. So you can see, the good thing is that she's actually talking about it. But that is something that many people go through, and they do so silently. They don't go out to seek help.
Okay, let's go back to the WhatsApp text messages. Hi, doctor. I'm a very fertile man because every time my wife and I agree to have a baby, it happens within a month. I have 5 girls already, but I desperately need a boy. Is there anything I can do specifically to have a baby boy, because we're planning to have another baby?
Well, unfortunately, there's not much in his control that he can do in terms of choosing the gender of the child. If you go into Google once again, there are people who claim that if you did this, you did that, then you increase your chances of having a child. If you eat this kind of food, if you assume this kind of position during intercourse, all of that is speculation. And it is entirely by chance that you'll get the gender that you are getting. I often tell people, even yesterday when I was talking to my colleagues during our operating session, I tell most of my patients that there is only one, as far as I'm concerned, there is only one recipe, and that recipe is prayer. You go and pray to God and ask God to give you the child that you want. But God, when He answers often, He gives you what you need, not what you want. As for all these other things, I would not like to mislead the public to say, do this, do that, do that. There are some of the doctors who apparently tell people to do certain things that are apparently meant to improve their chances of achieving a particular gender. In the many years of doing this work and having read most of the textbooks in this regard, I haven't come across on any of these things.
All right, we are taking all of your gynecology related questions. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send us a voice note to 060-771-5107, 060-771-5107, or you can give us a call as we continue with this conversation after the break.
Say, call us now on 015-151-1058.
The Ulight sale is now on. Save the planet and your pocket with savings of up to 50% on energy-efficient lights. Decorate your home with Ulight's wide range of fashionable quality lights and enjoy a hassle-free 12-month guarantee. Visit our Ulight stores in Sanin and Polokwane or shop online at www.ulight.co.za.
Choose Boxer.
Oh, no, okay,
when
Doctor,
you buy Baby Soft Mini 2
the concept of urinating,
Boxer Mask 2
Aspade,
buy
what's
two
the appropriate
and
term?
40 rand. Choose Boxer where you
And then
Do
menstruation.
you want to pay your bills?
Go
Buy
tap.
airtime, transfer or receive
Go
money
tap.
on planes.
Go back, go back,
Do
quick.
that
That
and
will
much
make
more.
it known to a doctor, but I don't know if we are going to play it or not.
From
I
next week,
so I don't know.
I think we can play it and then the doctor will correct the language.
Yeah.
Yeah.
That's fine.
Yeah. I had said or we should have a disclaimer before the show. I'll just fix it tomorrow. I think it needs to happen.
But I can't quite everybody is to urinate.
Yes.
Hey.
Can't digging.
I can even
Go tlhapologa, go ntsha metsi. You must tone the language, especially if you are going to talk. Yeah.
Okay. Wow.
Come check out the new Beauty of the Bride bridal boutique opening in Polokwane on Thursday.
Okay, let's fly, doctor.
Get a 20% discount on all wedding dresses hired in April. Visit Shop 13, Standard Bank Square, beautyofthebride.co.za or call 072-472-5181 to book a free appointment. Beauty of the Bride. It's all about the dress.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The time is 11 minutes to 7. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke, and we're talking all things gynecology by taking all of your gynecology-related questions. Send them through to our WhatsApp text line 079-295-1212, 079-295-1212, or you can send us a voice note to 060-771-5107, 060-771-5107. Alternatively, you can give us a call.
Have your say. Call us now on 015-151-1058.
015-151-1058. That's the number to dial. Let's listen into a voice note, doctor.
Doctor, I have a lot of vaginal discharge, and my question for you tonight is having discharge on a daily basis normal, or should I be alarmed?
Doctor, it's a group of fellow because the when they are perhaps me, so I get what I will cook or I explain what was going on.
All right, doctor, let's start with the first question.
Yeah, the first question pertains to vaginal discharge, and she wants to know if it is normal to have it daily. The answer is yes. There is a normal discharge, and that is part of the body's way of cleansing itself. Because in the discharge, you get dead cells. You know, the body is manufacturing new cells, and the old cells are being shed. And these cells then would be removed in the form of a discharge. We had said a normal discharge does not have a bad smell, it's not itchy, and it's whitish in color. We only worry about the kind of discharge that changes color and starts to have a smell and or it's itching. Then those are signs that this could be an infective process. All right, so it is normal to have a discharge on a daily basis. She has nothing to worry about, unless there are those points that I've mentioned there.
Second
question. Firstly, we need to ask the listeners to tone the language. Instead of saying gorota, this is a family show. We would prefer them to say otlapologa goba go ntsha metsi goba go fatla magotlo ke mokgwa o mokaone wa go bea ditaba. A re popelo e botlhoko ge a fatla magotlo, right? The anatomy does not support this kind of statement, that when you pass urine, the uterus will be painful. The uterus is entirely separate from the urinary system. The urinary system is comprised of the kidneys, the ureter, the bladder, and the urethra. These are separate from the uterus. So passing urine and experiencing pain would probably have nothing to do with the uterus. It is not the uterus that is painful. It is probably the bladder, indicating that there is a urinary tract infection. So we must not blame the uterus for this. Okay? And it is easy for urinary tract infection to be diagnosed. You simply give a urine specimen and a bedside test is done, what is known as urinalysis. We go and test if there are any bacterial cells there, the presence of nitrites, and so on. All these things, or even proteins and blood. All these things will then tell us that there is a urinary tract infection. It has nothing to do with the uterus.
Okay.
Right.
Good evening, Dr. and Rebecca. This is Mbali. I'm 25 years old and I'm using Trifacil pills as contraception. I had my normal periods last month and in due for my next periods around the 17th of April. However, last week Saturday I had painful pains in my stomach all day and I drank lots of water to subside the pain. When I woke up on Sunday, I woke up to seeing blood that came as clots. I want to know if it's possible that I was pregnant and I had a miscarriage or it's something else. I last had sexual intercourse the Wednesday before I had pains on Saturday.
Look, every time a woman experiences disruption of her cycle, pregnancy becomes a factor, all right? We can only speculate at the moment. But the fact that she had pain and she passed clots and bled unexpectedly, it could always indicate that she may have been pregnant. But we can only confirm that if she is examined and a pregnancy test is done, and especially the one that is blood-based, not the urine one. At the moment, I assume that she no longer has the symptoms. So if she no longer has the symptoms, even the presence of the pregnancy hormone might be gone, and therefore it might no longer be possible for us to confirm whether she was pregnant or not.
But would you say to just be on the safe side, she should go consult?
She should go and consult, yeah.
And how common is it that when one is on Trifacil, they could experience something of this sort and it turns out that they miscarried?
It's not very common.
Okay.
But like we said previously, that any form of contraception has a failure rate. So even if you are on the pill, the chances of falling pregnant are still there. And even today we talked about this. One of the most important things, Rebecca, is the timing of initiating this. If you were to start taking the pill randomly, in other words, you're not menstruating at the time, you must know that you're not protected for the next 2 weeks. All right? You have a chance of falling pregnant even when you are taking the pill and taking it correctly, if you start it randomly. But if you were to start it during your period, then the protection is immediate. You will be protected immediately. So there are people who will come and say, I want to use the pill, and they are given the pill, they start taking the pill, and within that first cycle, they've conceived. Then they say, it doesn't work. Perhaps we are to blame as healthcare professionals. We need to guide people. So if you start it when you're not menstruating, please abstain for the first 2 weeks or use protection until the 4 weeks elapse or the 2 weeks elapse and or the period comes, depending on which comes first. This is important.
Okay. Let's listen into a voice note, doctor.
Studio. Like, doctor, I'm experiencing this thing on my right hand side breast. My breast is bigger than the left side one. So the right one, there's this discomfort that I'm feeling. And when I press them, it's the same as that one on the left side. But there's this discomfort that I'm feeling, and also it hurts. It's not normal as my left breast.
Doctor?
Right. As usual, there would be a few other things that we would have preferred to know. One of the things we want to know is how old she is. One of the other things we want to know is what form of contraception she's on. One of the other things we may want to know is whether she's breastfeeding or not, and so on. And one of the most important symptoms as well, whether there is any discharge from the nipple. And if there is a discharge, what kind of discharge? Is it a clear discharge or is it a bloody discharge? However, I'm glad that she says one breast is bigger than the other, and this is normal for many women. The two breasts are not likely to be the same size, and that is not a problem at all. But if the disparity in size is very marked, then it could suggest that the bigger breast has a problem. The difference in size is rather subtle. It's not a very pronounced kind of difference. So if this difference is too much, then it could indicate that there's a problem. She's talking about the discomfort, but the discomfort could just be a hormonal thing. The one thing against that is, why is it one-sided? If it is a hormonal thing, why does it affect one side and not the other? All right, because the hormones are in the blood, and this blood gets to both breasts, and therefore, if it is a hormonal thing, it should be bilateral. It should not be unilateral. There could be an infective process, what we call mastitis, that is going on there. But once again, I would say, let her go and be examined. Although I have repeatedly said that cancer of the breast does not present with pain. Right? Pain is a very late feature, but it's always better to go and be examined. And if she's in the age group where mammogram can be done, she'll be referred for that.
Okay, let's go to the questions on the WhatsApp text line 079-295-1212. Good evening. So my partner just told me that she's pregnant and she's 3 weeks pregnant. We agreed that we're not ready to keep the baby. So my question is that, what is the safest method of termination? Secondly, how much will the whole procedure cost, either public or private hospital? And is the medication going to be purchased at pharmacies or only in hospitals?
Okay, I think the question is clear.
It is.
Right. They would like to consider terminating the pregnancy. They want to know what is the safest method to do it. And they want to know what is the cost and whether they are going to purchase the medication.
Yeah.
All right. If the pregnancy is as early as he says it is, then it becomes very easy. Because the safest method that is done is a tablet that is prescribed and given to the individual to drink. Often they are given the tablet to take home, and they are told to come back the following day. If the tablet is working, they will come back bleeding. Okay? Then she will be examined to see whether the whole pregnancy has been expelled or not. If she has aborted completely, then there is nothing else that needs to be done. But if she has bled and some of the products of conception are still inside, then she will have what we call evacuation. The process to terminate pregnancy has been legalized in the country. And one of the things that the government has done is to make this service free for the citizens in the state facilities. Okay, there is no private hospital, as far as I know, that does this procedure. Okay, but there are private doctors that participate in the process of terminating pregnancies. The cost is different from one doctor to the next, so I would not be able to answer that, because some doctors would say, oh, if I do this, this is how much I must be paid. But in the state facilities, in the clinics, in the hospitals, you do not pay a cent. This is free. So and the medication that is used is available in these facilities. Okay. You don't buy it yourself. They'll give it to you.
So you're saying at private hospitals they don't do terminations?
No, they don't do terminations.
Is there a reason?
They decided not to participate in this whole thing. Okay. People have an opt-out clause. You can opt out. Even in the state, there are people who are conscientious objectors. They say, no, Mina, I will not be party to this. And the law allows that.
Okay. Let's talk to Anonymous, who joins us on the line now. Anonymous, good evening. Welcome to Conversations.
Tabe. Ronald Guy.
Yes, talk to us, Anonymous.
Onali mngemi kaina. Onali 11 months. 11 years. Osai majaji. And you are 29. Obe o tlhaba. O tlhabile nako e kaka. 11 years ka moka o tlhaba tshwana. Ke yona e beng e dira gore o saya matšatši. E šoma ka mokgwa. Ga botse fela. Go e tlogetše, it will take time gore mmele wa gago o boele sekeng. But ultimately period e tla boa and o tla kgona go dira ngwana.
Thanks, Anonymous. Okay, let's listen into a voice note.
Good evening, Doc. My question for you tonight is about the vaginal odor. My main concern is specifically about the fishy smell. Like, I would like to know what are the causes of it. If it's either caused by the product that we use when we are bathing, or will it be that one is having sex regularly? Like, I just want to know what are the causes of that fishy smell, and if so, I would also want to know what is the best way for one to do when cleaning the V-part, vagina is. And another thing is, like, is it normal to have a lot of vaginal discharge daily? That's another thing that I would also want to know.
Okay, doctor?
Well, the vaginal discharge is trending today.
It is.
Right.
Yeah.
I think maybe it is a problem for many people.
Sure.
But the listener has given us a very descriptive term, that of a fishy smell. And this is typically how bacterial vaginosis presents. Bacterial vaginosis, as opposed to bacterial vaginitis. Vaginitis is talking about inflammation as a result of infection. Vaginosis is talking about overgrowth of the normal bacteria that you find in the vagina. And this normal bacteria will release certain chemicals when certain things happen, particularly when the pH of the vagina goes up. And this is typically observed during menstruation and also during intercourse, because the pH, the vaginal secretions, are such that the acidity of the vagina is reduced. When that happens, there is a release of certain chemicals known as amines, and the amines will then give out this smell that is fishy. It's bacterial vaginosis. It's not an infection. It is under the control of hormones. During certain times of your cycle, whether you have intercourse or not, you will experience this, right? And because it's a hormonal thing, you will be given medication. It will go away for a while. It will come back, right? And often when we vagina, you will be advised to use just the water, maybe with a bit of salt inside. You don't need to be using these deodorized or perfumed substances that you buy over the counter, because those would actually disturb the vaginal environment, and you will then find that you experience this the recurrence of the bacterial vaginosis. So in general, we don't encourage people to be using all these commercially available things, but you can just use water if that is what you prefer doing.
And just going back to what you answered with regards to the fishy smell and the treatment that has to be taken, where you said that the male partner does not necessarily have to take the treatment.
Yes.
In terms of same-sex relationships, particularly for lesbians, what is the advice in that particular regard?
Well, in them, because they are both females and they could be, and their hormones are the same, you may find that they experience the same thing at the same time. I had said previously that it has been noted that women who spend time together tend to have their cycles synchronizing. So, like we said, it's a hormonal thing. They may experience it at the same time, and then the treatment would be for both of them.
Okay.
But it does not actually confirm that this is a sexually transmitted infection.
All right. So it's just entirely about hormones.
Yes.
Okay.
Right.
Hi, doctor. I was diagnosed with PCOS and I was given medication to conceive. I had my baby through C-section, but since I gave birth and started to have sex last year, I've been experiencing bloating every day. What could be the problem?
Right. Bloating might have nothing to do with the fact that she's having intercourse, because bloating is on the gastrointestinal system. She could be having a condition known as irritable bowel syndrome or a spastic colon, which is also just like PCOS, not a very easy condition to deal with. But there is treatment for it, and there is also dietary advice that she may need, because there are certain foodstuffs that enhance the formation of gas in the intestine. Therefore, if you are suffering from irritable bowel, you need to avoid the gas-forming foodstuffs, such as cabbage, such as nuts, eggs, milk, white bread, things such as those. Then you may find relief. But once again, she also needs to be examined.
So is there a link between the diagnosis of PCOS with the symptoms that she's describing?
No.
There isn't any?
No.
Good evening, doctor. My partner and I tested for HIV and we're all clean. So I want to know if it's safe to have sex with your partner without protection while breastfeeding.
Yes, if both of them are negative, there is no reason why they should worry.
Okay.
Yeah.
Perhaps let's then take this time to talk about instances where one partner is positive.
Right.
And in instance like what they are explaining now, when the partners would like to start having intercourse without protection, what's the advice then, doctor?
Today I saw a patient who is breastfeeding. She delivered a baby. She was coming for a 6 weeks checkup, and she delivered by cesarean section. Then she tells me that, look, my partner is positive and I'm negative. I've tested throughout the pregnancy. I'm worried that I'm breastfeeding and maybe that can affect my baby. Now, this kind of situation is the undesirable one, where the man is positive and the woman is negative. Because from the man to the woman, it is very easy for the virus to move. Whereas from the woman to the man, it's not so easy. So if you have this kind of situation where the man is positive, the woman is negative, and you don't use protection, that woman will end up being infected. There's no question about it. And when I got into discussion with her, she says, he has said, yena condom ya mopalela. Akasiberikisha condom at all. And I found it difficult because it's just applying the condom and have intercourse. Because basically he's saying he won't enjoy intercourse if he uses the condom. And now he is going to infect her. And she went on to say, I would rather win my baby from the breast, because as far as intercourse is concerned, we're going to have it unprotected. Therefore, my baby might be infected. Now, the issue of discordant seroconversion, where one partner is positive, the other one is negative, the advice would always be use protection. Use protection up until you want to have a baby. Assuming, of course, that the other partner who is positive is on ARVs. If he's on ARVs and there is complete suppression of the virus, in other words, the viral load is undetected, then when they want to have a baby, they can stop using protection until she conceives. And once she has conceived, they go back on the condom. But there is always that chance of her being infected, even in the presence of undetectable viral load. The risk is not zero. The risk of getting the virus is there. So it is important, therefore, once one partner tests positive, to inform the other partner, and the other partner must test. And then, even if both of you are infected, even if you are both on ARVs, there is still the advice that says use protection because of the risk of reinfection. And this is because when the virus starts to multiply in your body, it produces offspring, the genetic material of which is not the same as the original virus. So you're producing a new virus and he's producing a new virus. If you don't use protection, you reinfect each other. And this will enhance weakening of your immune system.
Okay.
Right.
I'm in conversation with our resident gynecologist, Dr. Maluleke. We are talking all things gynecology by taking your gynecology-related questions. Send them through to our WhatsApp text line, 079-295-1212, 079-295-1212, or send us a voice note to 060-77151, 07060-7715107. We continue taking all of your questions after the break.
Have your say. Call us now on 015-151-1058.
Are you experiencing blurred vision, headaches, or painful eyes? Spectacle Hut can help you. We offer full comprehensive eye examination at affordable prices. Branches in Polokwane, Thornhill Shopping Center, and Library Gardens. Also in Thoyando, Makado, Malamulele, Giyani, Elam, and Musina. Take advantage of the following specials at all our branches. Buy one, get one free, 20% discount on frames, lenses for pensioners, and Wellness Wednesday packages from 950 Rand. Visit spectaclehutsa.co.za or call 015-291-2920 for appointments. Spectacle Hut Optometrists. We are more than just eyewear.
Does your school, church, company, society need tailored clothing, uniforms, printed caps, t-shirts, and beanies in Polokwane? Well, Moti Branding is your go-to shop. Visit Moti Branding at Hostel Block H in Zone 6, Sesheo, or call 015-223-0674. We supply all over Limpopo. Moti Branding. We do it in style. Reclaim your safety and go beyond driving at Duca Driving Academy. We offer learners and driving lessons for Code 8 and Code 10. Duca Driving Academy is reliable with its experienced driver instructors. Visit us at 98 Skuman Street in Polokwane and 126 Chanduko Street in Toyando. Secure your spot now through WhatsApp or call 082-581-9702 or 079-620-4031. Duca Driving Academy, we are a complete driving school since 2009. Limpo Security is a specialized security company passionate about serving private companies and government institutions. We offer armed response, guarding, access control, special events, CCTV installation, ICT networking, and many more. No job is too dangerous for us. Our services are structured to meet specific clients' needs. Visit factory number 5C, Unit 1 and 2, Freedom Drive, Seshego Industrial Site, or call 015-223-0675. That's 015-223-0675. Email info@limposecurity.co.za. Limpo Security, we protect and defend.
Shh. Ashifa Breakfast.
Stimela. Whispers in the Deep. Yeah, it's a festival at Zanzibar and about the 87. Yeah, no. Boda, Stimela.
Yeah.
CJB. Lucky Dube. Brenda Fassi.
Yes.
Messi Pagel.
Okay.
It
was very peaceful though.
Peaceful.
Yeah.
People were minding their own business.
In the conduct, yeah, but
Oh.
They will be announcing on the stage to say, we've got a...
Serious?
They say, Nokia 5110.
No, they were just reflecting. We're not judging anyone right now.
That's why at our age, you won't see me, Kinali, something, I was stabbed or something like that. But your generation, 1920, they make their 6 stitches on the foil. You ask them, but it's 19, what have you been up to?
Literally was bad then. Yo, man. How did I get here, man?
Ashifa Breakfast, Monday to Friday, 6 to 9 a.m. on Energy FM and Choice FM.
If you don't know, now you know.
Conversations with Rebecca.
The time is 20 minutes past 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke, and we're talking all things gynecology. You're more than welcome to join us in this conversation. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send us a voice note to 060-771-5107, 060-771-5107. You can also give us a call. That number to dial is 015-151-1058. Let's go back to the WhatsApp text messages. Good evening, doctor. So, can one conceive again if they have PCOS, or do they have to take medication again?
Right, good question. Yes, PCOS has no cure. All right? You cannot say, we have given you treatment and therefore you are well. The likelihood is she will struggle again for having her second child. But with treatment, she should be able to conceive. So yes, she will need to be treated the same way that she was treated the first time, so that she can have another child. I have observed in my practice that there are a few women who will struggle with the first child, and then the second one, they simply conceive spontaneously. But there is also a sizable number of women who struggle still. And some of them even think it's not going to happen. And when they least expect it, they have conceived. Today I've seen a patient who came to see me for the first time. When she says she has not even been seeing her periods at all, and she comes in and she's around 27 weeks pregnant, and the pregnancy is normal. So some people will not see their periods at all, and even in that situation, they still manage to conceive.
Perhaps talk to us briefly about this treatment process. What does it entail exactly, doctor?
The treatment would be to give, because the problem here is what we call insulin resistance. So you are given medication to try and deal with this insulin resistance. The commonest drug that is given is a drug that is normally given to people with diabetes mellitus, what is known as metformin.
Okay.
It has been found to improve the insulin resistance. But in most instances, it's often combined with ovulation-inducing medication. All right, so because these women are not menstruating, you are given medication that will bring your menses back. Once you start menstruating, then you are given ovulation induction medication. This is for those who want to have a child. Remember, there are younger women who may not want to have a child. All they want is to see regular periods. In that group of women, we put them on the pill, and then they will have menstruation only when they are taking the pill. When they are ready to have a baby, then we switch to this kind of treatment that will then improve ovulation. One of the most important things with regards to treatment is weight loss, because women with polycystic ovarian syndrome also struggle with weight gain. And we have found that losing weight is a major part of the treatment. So if you go and see a dietitian or even go to the gym with the intention of shedding the weight, you may unlock the abnormality, or you may remove the abnormality that is there, and then your cycle starts to be regular, and you conceive. So those are some of the things people may consider.
Okay. Good evening, doctor. I feel like my menstruation blood keeps changing. Sometimes it's a lot, sometimes it's less. What does it mean?
There might be no problem there. It's just the normal fluctuation in terms of ovarian function, and there might be no indication that there's a problem. So she doesn't have to worry.
Is it something that's generally known?
Yes.
To say it can't be the same. The flow can't be the same.
It can be. It will. Some months will be heavy. Other months it might be scanty. It's only if this is persistent. If it is persistent, then yes, it suggests there's a problem. But if, just like some people will have delayed menses, you expect it this week, it doesn't come, and next week it comes. If it is just a once-off kind of thing, we don't worry about it.
Okay. A follow-up question from the listener who said their partner is 3 weeks pregnant and they asked about termination of pregnancy. They're asking now, so if she's pregnant for more than a month, when will the process be done, and will it be painful? And if she's only 3 weeks pregnant, will that pill that she's going to take result in pain? Is she going to bleed the following day?
Right. The listener is talking about 3 weeks and 1 month. The process of terminating pregnancy, as per the law in the country, says any woman who's pregnant and wishes not to continue the pregnancy, as long as she's below 12 weeks of that pregnancy, she can go and have the pregnancy terminated. Everybody gets given the tablet that we're talking about. There is a group of women who are non-responders to this kind of medication. You give them the medication and repeat it, and they still don't bleed, because their bodies do not have receptors for the tablet to latch on and then act. But the majority of women will actually bleed, some within hours of getting the tablet. Yes, the pain will depend on the duration of the pregnancy. The earlier it is, the less the pain. The more advanced the pregnancy is, the more the pain you are likely to experience, because now as the pregnancy is more advanced, you will get pain similar to labor pain. But if it's early, you'll get period-like pains. it will just be cramping similar to period pains. So yes, most of these people will have pain even in the earliest of the pregnancies.
So it means in this particular regard, they don't have to worry much because
no, if it's still early, the bleeding might also not be heavy, and the pain will just be period-like.
Do you find that the thought of terminating pregnancy and the pain that's expected to come after actually frightens a lot of people?
Yes. Pain seems to be a major stumbling block to a lot of things. Even inserting the intrauterine device, some people will say, oh, is that not painful? Doing a pap smear, is that not painful? Going to do the x-ray of the womb, is that not painful? So pain is actually a major factor in most people. And it is a very subjective thing. Your experience of pain is not similar as mine. And some of the people can only know whether it is painful or not once they've done the procedure. But I cannot say to you, look, it's not going to be painful. How do I know? Because it is only you who will experience this pain. And how you respond to the pain has a lot to do with your own psychological makeup, your own upbringing. We see that even in labor. There are people who may have been brought up to endure pain, and they will not say a word. You only hear them. The first time you hear is when they are pushing the baby out. Throughout that labor, they are quiet. And there are those who will be screaming from the beginning of the labor to the end, and it will just be a noisy labor ward. So it differs from one person to the other, and it is not easy to predict how people are going to respond to pain.
Okay.
Yeah.
That is our time, Doctor. Kindly share your contact details with us.
We are at 72A Compensati Street in Polokwane, 015-295-9407 or 295-9419.
Our next appointment is next week, Doctor. Thank you very much.
Thank you and good night.
That is our time on Conversations. Coming up next is Night Flight with Matumo Manaka. A big thank you goes to the show's technical producer, Emmanuel Pinda, and to you for always listening and interacting with us. I am Rebecca Pala. Enjoy the rest of your evening and stay blessed.
Conversations with Rebecca Pala.
I'm worried about this male listener who's asking questions about termination of pregnancy. He keeps referring to it as vacuuming. He keeps saying, well, they vacuum her. And even the tone that he used when he started, he said, she tells me that she's 3 weeks pregnant, but we agreed that we're not going to have a baby. He just sounds like an angry man.
Yeah, actually, you can see that